Bismillahirrahmanirrahim. So coming on towards the last topic of pancreas pathology, we'll talk about malignant tumors of the pancreas. The most common of the malignant tumors of the pancreas is pancreatic adenocarcinoma. Let's break down the name of this cancer. Adeno means gland-like proliferation, and carcinoma means malignant cancer of neoplasm of epithelial cells. So pancreatic adenocarcinoma is the malignant proliferation of the pancreatic epithelium, more specifically the ductal epithelium of the pancreas. So this cancer is more common in the males rather than in females and more predominant in blacks and Ashkenazi. The mean age of the development is 60 to 80 years, with the average age of patient being 66 years. So the risk factors of the pancreatic adenocarcinoma can be classified into modifiable and non-modifiable risk factors. So modifiable risk factors means those risk factors which can be avoided or can be changed. Smoking is one of the most common cause of the cancers, and alcohol is the culprit that results in chronic pancreatitis leading to cancer. So obesity and the foods rich in the trans fats is also known to cause adenocarcinoma. The non-modifiable risk factors include blacks and the age 60 years and above. Genetic mutations in the BRCA2 genes also predispose a person towards the pancreatic adenocarcinoma. The other risk factors include chronic pancreatitis, which can be due to any cause. Adenocarcinoma of the pancreas is known to arise from a precursor lesion, which is known as pancreatic intraepithelial neoplasia or PAN-IN. This figure is taken from the Robbin's textbook. This here, as you can see, is a ductal epithelium of cuboidal cells. This undergoes change in size and shape. With the mutations in the KRAS genes and shortening of the telomere, there is increased cell growth and change in the size and shape of the cells, as you can see here in this portion. This ultimately results into the transformation into invasive carcinoma, which is characterized by the formation of a gland, as you can see, and invasion within the deep tissues. Let's understand the pathogenesis of the adenocarcinoma of pancreas. So like all the cancers, there is always a mutation in the tumor suppressor genes and proto-oncogenes. Just to recall, what are the tumor suppressor genes? These are the genes that keep the cell growth and cell division under check, which means it inhibits the cell division and keeps the cellular population under the control. And proto-oncogenes are the genes which enhance the cell division and cell growth. So what happens is that these genes undergo a loss of function mutation, which means that they lose the function that they were performing. So what happens as a result is that there is increased cell growth. Likewise, in the proto-oncogenes, which include TP53, P16 and SMAD4, there is a gain of function mutation, which means the mutation has resulted in the increased performance of its functions. So as a result, there is increased cell growth resulting in tumor formation. There are other mutations that are also identified to be associated with the adenocarcinoma of the pancreas. One of these the mutations in BRCA2 gene, which is positive in almost 10% cases of the adenocarcinoma in Ashkenazi Jews. Coming on towards the morphology of the tumor. So these tumors typically arise in the exocrine region in 95% of the cases and in 5% cases in the endocrine region. So mostly these tumors involve the head of the pancreas, which is in almost 60% cases. Then there is body and tail. In 20% of the cases, these tumors diffusely involve whole pancreas. So these tumors have a hard surface with pale color and they have poorly defined margins, which is due to the deep infiltrative growth and invasive nature. So the tumors which are typically present in the head of the pancreas obstruct bile duct, resulting in jaundice. Before moving on towards the histology, you have to remember these 5 points to easily understand and remember the histopathology of any tumor. So the first thing that you have to do is that you have to divide the histopathology into 5 points. You have to identify a tumor on basis of these 5 points. So the first one is pattern recognition. Pattern recognition means that the neoplastic cells are forming a specific pattern, which can be either glandular, tubular, cluster of cells, cord-like structures, or any other pattern. Next is the cell microscopy, where you have to explain whether these cells are well differentiated, which means they resemble the colony from which they originated. But they can also be undifferentiated, which means that the cells cannot be differentiated whether they belong to any specific part. So these cells are typically round, have central nuclei, they have abundant cytoplasm, and cannot be classified as a specific cells. The next is a specific feature of the tumor. All the tumors have a specific feature. This portion particularly includes that specific feature of the tumor in the histology. The next is mitotic bodies. So in case of malignant tumors, the mitotic bodies are always present, which means that the tumor is invasive. Whereas in case of the benign tumors, the mitotic bodies are mostly absent. The focal necrosis means hypoxia and lack of blood supply. So the focal necrosis is a typical feature of a malignant tumor, whereas it is absent in the benign tumors. Now let's move on towards the histology of adenocarcinoma of pancreas. The first point we talked about was that we have to identify the pattern of the cells. So these are highly invasive cancers that form either tubular or glandular pattern. They may also form cell clusters. This, as you can see, is a tubular pattern, and these are poorly formed glands. The cells are pleomorphic in nature, which means they have variable shapes. As you can see here, the cells are all of variable shapes and sizes. These cells range from well differentiated to highly undifferentiated cells. The poorly formed glands here are lined on the inside by either columnar or cuboidal cells. Focal necrosis is positive in the pancreatic adenocarcinoma, which indicates hypoxia. Since these cancers are highly invasive and deeply infiltrative in nature, these are highly positive in mitotic bodies. So the specific feature of this tumor is that there is an intense desmoplastic reaction. Desmoplastic reactions means there is activation of fibroblasts in these tumors. So the fibroblasts result in the fibrosis within the tumor. Here you can identify the fibrotic areas within the tubular and glandular structures. So these tumors are highly invasive in nature. There is perineural invasion, then there is lymphatic invasion, and they also invade along the major blood vessels. Coming on towards the clinical features, like all the cancers, pancreatic adenocarcinoma also presents with the atypical symptoms such as nausea, vomiting, and anorexia. The most common complaint is epigastric pain, which gets worse when the patient lies flat. There is also a history of weight loss. Courvoisier sign might also be positive in such patients. The positive Courvoisier sign means that the gallbladder is enlarged and it is palpable on examination. This happens when the adenocarcinoma is present in the head of the pancreas and compresses the bile duct, resulting in obstruction. This leads to elevation in the bilirubin in blood or bilirubinemia, resulting in jaundice. Bilirubin is also excreted through the urine, which is known as bilirubinuria. There is also formation of the blood clots in the subcutaneous veins, which appear and disappear frequently. This is known as migratory thrombophlebitis, or also known as positive trochosign. The tumor markers for pancreatic adenocarcinoma include carcinoembryonic antigen and CA19-9. Both of these tumor markers are non-specific, that's why they cannot be used to screen the large population for the early detection of adenocarcinoma. Other malignant tumors of pancreas include SNR cell carcinoma. There is increased production of zymogen granules, which result in the production of trypsin and lipase. The lipase enzyme is transported through blood to the distant sites where they cause fat necrosis. This is known as syndrome of metastatic fat necrosis. Pancreatoblastoma is a rare form of cancer which occurs in the early age of 1 to 15 years. These cancers are typically identified by the presence of squamous cells along with the SNR cells on histology. That brings us to the end of pancreas pathology. If you have any questions, do let us know in the comment section. Thank you.